Hello, everyone, and welcome to the 2024 Digital Marketing Trends Survey webinar. Today's webinar is presented by Geonetric. At Geonetric, we are a full array of digital experience, website design and development, as well as a digital marketing services that are focused on the needs of healthcare organizations. As a digital experience agency with deep technical and creative expertise, we provide hospitals, health systems, and medical groups with digital experience strategy, digital transformation consulting, experience consulting, website redesigns, as well as creative digital services optimized for the unique needs of the healthcare industry. And you don't have to look too far to see the kind of positive impact that comes from the partnerships between our team and the clients we serve. Leading the discussion today are myself, Thomas Fazio, and Geonetric CEO Ben Dillon. A little bit about me. I joined Geonetric back in April of 2023 as a senior digital solutions advisor. I enjoy helping healthcare systems create digital experiences to engage their local communities. Ben Dillon is a co-owner and the chief executive officer at Geonetric, which he joined in 2000. During his time here, Ben has become an influential voice in healthcare digital marketing and helps organizations across the country engage healthcare consumers by improving their digital experiences. He is a former SHISHMED board president, a 2022 Healthcare Internet Hall of Fame inductee, and serves on the editorial advisory board for eHealthcare Strategy and Trends. So our webinar will run approximately 1 hour. If you are listening on a speakerphone, we recommend you mute your line to prevent any audio issues. We will also answer any questions at the end of the presentation, so please enter them into the questions box. We do depend on your feedback to make our webinars the best they can be, so please take a moment to complete the survey at the end. And finally, a recording of this presentation will be posted on geonetric.com in the webinar section, which can be found under the main stories heading. I would now like to hand things over to Ben.
See if the camera comes online here. It was working just a minute ago. There we go. Thank you, Thomas, and thanks to all of you for joining us today. I'm absolutely thrilled to be sharing our most recent research with all of you as we look at digital marketing trends in the healthcare space. We've run these surveys, we say we run them on an annual-ish basis. So every year, every other year, we did our first survey in 2005. This is our 12th installment in our survey series here. So every year, every other year, great insights every time we go out and gather this information. We go out and ask a bunch of questions of folks from digital marketing in healthcare organizations, and we had 147 people from inside those healthcare organizations respond this year. We also collect data from the agency and vendor, consultant, and solution providers that work with and support those digital marketing professionals. So it's a little bit narrower survey, really intended to get some contrast between people inside healthcare organizations and outside healthcare organizations to see where their perspectives may align and in places where they might not. And we had 55 of those agency vendor respondents this year. And a huge, huge thank you to our survey advisory board. So the last couple of surveys, we've assembled these amazing groups of folks from inside health systems, outside health systems, consultants, agency folks, media folks, just getting a broad perspective on what are the questions that we should be digging into in more detail, really looking at the pacing of the survey, the length of the survey, and are we asking questions in a way that honestly all of you are going to actually be able to answer and that are going to get us to the kinds of insights that we're looking for out of the survey. So huge thank you to these folks. This survey is much better for your continued involvement. So thank you for that. Now, you're all going to get copies of the ebook after this is all done. we cannot talk about in this 1 hour all of the things that we asked about in the survey, all of the things that we've got included in that ebook. So we're going to hit some highlights today. We're going to talk about the things that we as an industry are doing well. We're going to talk about where we're investing, how we're staffing our initiatives. We'll get into some digital marketing topics, and we've got a selection from what we're thinking of as our hot topics as well. These are some areas where we deep dive. In particular, we're going to be looking at HIPAA guidance and then generative AI as well. One of the things you'll hear me referring to again and again throughout our time together today is not just how the industry overall is doing things or where they rate it or what's important and so forth, but oftentimes I'll really focus on where leading digital groups are doing things differently or where they're doing things differently than laggards. I thought I should explain a little bit where that comes from. It's not a judgment on our part. This is all self-reported data, but we ask each respondent for an assessment on a whole list of different functional areas, how they're doing relative to competitors. Are you significantly ahead? Are you significantly behind? Are you somewhere in the middle? We score all those things up. We add up the scores. We put every respondent out on this distribution, and then we break the group into digital leaders, average, and laggards. And this is a great way for us to kind of see some segmentation and understand how different parts of our industry are doing things differently. I also think it's really important when you're getting that ebook and you're working through the ebook, I would encourage you to go through and rate your organization on that same set of criteria, score yourself out, place yourself into one of these groups, and then read the rest of the report with that in mind. I think it really helps to inform and make a lot of the data here actionable when you understand I'm sort of in this peer group here, maybe I'm looking to step up to the next peer group. What are the kinds of things that they're doing that I'm not? What's their investment level compared to our investment level, and so on and so forth. Now, this is the actual set of different functional areas, and you'll see this appear again and again and again throughout the survey. We use the same list of functional areas in a whole bunch of different questions. But again, this question in particular is how are you performing relative to competitors? As you look at the chart here, you can see the leaders are doing better than the average are doing better than the laggards. It'd be really weird if that wasn't the case, because this is the unit we use to actually score this all out. And so something would be very strange if that's not the way this played out. But it also gives us insight into the areas where we as an industry feel like we're doing really well, the areas where we feel like we have a long way to go. So let's get into that a little bit. And when we look at the top of the list here, I'd say no real surprises. We feel like we're doing great in areas like social media and web design, in accessibility, and then video has been an area that's been sneaking up here and rounds out that top 5 this year. We feel like we've made, as an industry, a lot of progress on that video front. I actually think some of the more interesting stories are happening at the bottom of the list. We have things like mobile app development, CRM, personalization, UX research, and this year, of course, adding a new category into that mix, which is AI. So why is this interesting? Well, when we look at where we have the biggest gap between where leaders feel like they're at here and where everyone else feels like they're at here, some of those items are actually all the way down at the bottom of the list, which is not to say that leaders think that they're excelling or it's one of their top areas, but they're clearly pulling away from the pack. And the gap between these two things is so large that when we average up across the entire respondent base, the scores are still pretty mediocre overall, why they end up at the bottom of that list. In particular, point you to some things like mobile apps and personalization, areas where as a group we're struggling, but we're seeing leaders really doing some things at a very different level than the other groups. We also see leaders standing out in innovation, which is a little bit further up the list. That's a new addition to this list this year, as well as digital strategy. I love this digital strategy one because in our last survey, we saw leaders really investing in digital strategy, planning to hire, maybe adding people there, having it as a focus a couple of years ago, but not feeling like they were doing that well. Now we see leaders actually feeling like they're excelling in digital strategy. And as you'll see later, we're seeing some other groups start to pick up on that and prioritizing digital strategy as an investment area in the future. But it's really neat to see where we have a clear place where investment's happening and then we see where that needle has moved in terms of how we're doing on that particular metric. In addition to how we see organizations competing with their immediate peer group, we also asked how they're comparing to other industries. In particular, we asked this question, where are we furthest behind other industries? So the items at the top of this list are the areas where we felt like we were furthest behind. Now we've got two sets of bars here. The tan set is healthcare organizations and where they feel that we're furthest behind other industries. And then we have those agency vendor partners and their perspective on the same question. Now there's some places where there's a lot of alignment here, but there's some important differences as well, which I thought were really fascinating. So let's start at the top. This is all ordered by the healthcare organization's ordering of items here. And so healthcare respondents felt that they are furthest behind other industries in areas like AI and personalization, in innovation, user experience, and CRM, right? So these are all areas where we know there's a lot of interest. We have a lot of leader investment and things like that, but we have a long way to go. We feel like we have a long way to go as an industry in these spaces. Now, we have some agreement from vendors on this list, but we also have some important differences here. So vendors agree on that AI item, but they're following up with items like CRM, data and analytics, content development, and then personalization. And so some of the raw scores are similar, but some of them are very different here. In fact, when we look at the areas where we have the biggest gap between those answers, we're getting things like innovation, user experience, mobile apps, and then this last one, content development. Content development I'm finding fascinating here. You'll remember a minute ago, we thought we were doing pretty well as an industry in content development. Even here, we feel like we're not far behind other industries in this space, or maybe we're competing very well with other industries from a content perspective, from inside the walls. Vendors, however, this was the one big gap item where vendors felt like we were further behind than people inside healthcare organizations. The rest of those items where we had those big gaps, healthcare organizations perceived our industry being further behind other industries than the vendors did. All right, let's talk about the dollars. And the dollar question, the investment question, actually turns out to be a pretty difficult one to give a single benchmark stat on. So we approach this in a couple of different ways in order to hopefully give you the information that you need in order to benchmark appropriately, right? We've got a lot of different types of organizations and sizes of organizations. So we do capture these actual dollars being spent, and I should say this is dollars being spent excluding staff salaries and things like that. This is just the other dollars being spent. We'll look at the staffing piece here in a minute. The first thing I think, as anyone looks at this chart, is it's really, really clear that we have a strong correlation between the leader laggard groupings and the level of investment here. I will say that when you get into the weeds, there's no guarantee that spending more money necessarily moves you to the right in terms of those categories. We do have some laggard groups who are investing very robustly. We have some leaders that, relatively speaking, are investing a lot less money. But there is certainly a correlation between those two items. You also see that there's two sets of bars here. So the red bar is the mean, the average, right? We add up all the dollars, we divide by the number of organizations, we get a mean. And so when we talk about average, that's kind of what people expect. So we continue to include it in there. However, for every many organizations that might be spending $100,000 or $200,000 a year, one organization that might spend $10 million a year really kind of distorts that mean average. I like to focus a little bit more on the median. So again, this is that 50% point. Half of the organizations are investing more than this, half are investing less than this, maybe giving us a more realistic kind of typical spend level across these different groupings. Either way you slice it, though, those leaders are investing a lot more than the average and laggard groups. And in fact, even on the median level, they're investing 86% more than the laggards are investing. Now, you might look at that and say, well, they're just bigger organizations or that, any number of things. The reality is that there may be a little bit to do with size or overall budgets, but the reality is that there's also a huge factor here that just comes down to their level of commitment to digital. So we asked this question: what percentage of your overall marketing budget is dedicated to digital marketing? And we find for the leaders, it's 44%, average 35%, laggards 26.5%. So it's not just that the total dollars are very different, but the portion of the larger marketing budget that's being put into digital is also meaningfully different for leaders than it is for average, which is different than laggards. So we're not just seeing larger budgets overall, which translate into larger digital budgets. We're seeing a larger degree of commitment to digital as part of their marketing mix. Now, the numbers we didn't include here, and there's a little note there in the title, is we had some people indicate zeros. We put a note there saying indicate a zero if your digital budget is not coming from your marketing budget. We probably should have asked the question, where is it coming from? We did have 13.5% say that their digital budget didn't come out of marketing. Could be out of IT, could be out of digital transformation. We're seeing some of those situations out there today. They could have a dedicated digital budget that lives outside of marketing. We occasionally see this as part of PR, but wherever that budget is coming from, 13.5% indicated that their digital budgets did not come from marketing. So that's an overall picture of the investment level today, but we also like to look and see where do we anticipate that going here in the coming year. And I think this is a really great indication of just where we are as an industry right now, coming out of that financial funk that followed the pandemic. We are seeing a growing number of organizations that are seeing their budgets grow. But we're still seeing about 1 in 5 organizations that are anticipating budgets shrinking here in the coming year. Right? It's not the worst ratio that we've seen in the last couple of surveys, right? You know, we've got 50% more organizations saying we're likely to have a bigger budget in the coming year than we are saying we're likely to have a smaller budget in the coming year. But we still really do have that distribution. Despite all of the progress that's been made on financial recovery, we still have a lot of organizations that are finding their way, struggling to find their way to profitability. Now, we see again here, our leader-laggard groupings correlate pretty strongly with success on the budgeting side of things as well. Our leaders have 3 times more organizations that are expecting bigger budgets than shrinking budgets here in the coming year. Whereas our laggard group, it's almost the other way around, right? We have 31% expecting smaller budgets, 24% expecting larger budgets. So we do have some different correlations here. The leaders are doing better here as well. Implications of this, and I think we'll see this throughout the data that we're talking about here over the rest of the hour, is that we have a group of haves and a group of have-nots, and the leaders are definitely in quite a different position than the average and laggard groupings. And because of the way budgets continue to shift, because of hiring patterns, because of all these things looking forward, we anticipate that gap growing rather than shrinking. We don't see those average and laggard organizations making the kind of renewed commitment or new commitment to really be closing the gap with the organizations that are in that leader position. So we do anticipate continuing to see the gap between the haves and the have-nots growing. All right, shifting from dollars to staff. And if you thought that the difference in investment on the dollar side of things was pretty dramatic between leaders and everyone else, let's look at the staffing numbers, because the leaders also have tremendous teams, much larger teams than our average or laggard groupings, twice as many as both of those other groups. And so not only do we see greater dollar investment in a lot of these things, we see a lot more people behind the scenes able to execute within these groups as well. Now, we don't just ask what's the size of your team. We use that same set of functional capabilities, and we ask each respondent to indicate how many FTEs or portions of an FTE do you have dedicated to each of these functions. And so we get a good breakout of where the staffing is across this entire spectrum here. Content continues to be a key staffing priority, both content development, which was number 1, content marketing, which was just a couple more down the list here. That new category, innovation, came in number 2 from a staffing perspective, with really a great deal of parity between the different leader-laggard groups here in terms of the number of staff that they've got there. And then we also had things like general website management, project management, and data and analytics. Now, when we look at the areas where leaders are staffing more aggressively, with the caveat that they're staffing more aggressively everywhere, the areas where they're most aggressively, staffing above and beyond what we see from everyone else, we get areas like data analytics, CRM, and digital advertising. Each of those areas, we had 2.8 FTEs or more staff in leading organizations than we saw in laggard organizations. So really significant differences in those areas in particular. We also look here, and as we look at how organizations are getting things done, we look at the outsourcing mix here as well. There's certainly some things that are relatively easy to outsource at the top of the list there, like web hosting, web development, digital advertising. We also have some things that organizations tend to like to keep in-house. Those are the things at the bottom of the list: social media, project management, innovation. But for some things, the story is a little bit more complex. And mobile app development is one of those themes that I'm going to talk about quite a bit through our time together today. Just some fascinating things going on in that space. We see here, overall, relatively low levels of outsourcing of mobile app development. However, when we look at leaders, that's a much, much bigger number. So I think the largest gap in terms of the level of outsourcing here. The interesting thing on this one is, for most of the categories we look at here, if we're not outsourcing a function, the assumption is it's happening in-house, right? If you're outsourcing web hosting, you're outsourcing it. If you're not outsourcing web hosting, you still have web hosting, you're doing it in-house. A little bit different in the mobile app space. If you're not doing mobile app development out of house, there's some organizations certainly doing that in-house, but for the most part, if you're not outsourcing it, it appears that most organizations just aren't really doing it. They're taking something from their EMR, or they're just taking something off the shelf. They're not really doing anything in that custom app space. The majority of this work does seem to be outsourced if it's being done at all. The other thing as we look down this list is we might assume, because the leaders have such large staff, that they do very little outsourcing. There's a couple of areas where they do less outsourcing than everyone else, like web hosting. But as you look down the line, it's pretty clear that in most areas, they're doing as much or more outsourcing than everyone else, in addition to having those larger staffs and greater internal capabilities as well. We also look at where staffing is likely to go in the coming year, our hot jobs list. So these are areas with the most interest in hiring here in the coming year. And at the top of that list, we've got data and analytics, we've got digital strategy, we've got content development, CRM, and AI. Point you quickly to digital strategy, the number 2 item on the list here. In our last survey, we saw a big interest in hiring for digital strategy from our leaders. And again, as I mentioned earlier, leaders felt like they're just killing it from a digital strategy perspective now. That investment, that staffing up has worked for them. This year, we're seeing the average cohort going big on digital strategy and looking to hire digital strategy talent into the organization. So it'll be interesting to see next survey we run if they catch up in terms of how they're doing from a digital strategy perspective as a result of that. Those top 4 items, we think of as sort of mainstream positions. Most of those are pretty evenly staffed, relatively speaking. But I will draw your attention to the number 5 item here, AI. Of course, AI, new frontier, lots of buzz. It makes its way to this point on the list, though, almost exclusively on the back of leaders who are all in this area, or at least in a much more significant way than everyone else. So again, bigger budgets, larger staffs, the ability to experiment and to try new things. This is an area where they're investing in a big way. I think it may be another cycle or 2 before we see other organizations step up and start to bring resources to bear on this problem in the same way. They can't move as fast. They can't hire in the same way. They honestly, I think, want to see that this investment can translate into some real value for their organization before they go putting a bunch of investment behind it. Now, when we look at the other end of the spectrum, we look at where laggards are investing or hiring more than everyone else. They are shoring up some really core capabilities here. So they're looking at web developers, they're looking at digital advertisers, and they're looking at web designers from a hiring perspective. All right, let's talk about platforms and capabilities. So every time that we've run this survey in the past, we've looked at organizations' plans to redesign their primary destination website. And we also look at their plans to change content management platforms. And so this is the first one of those is the redesign plans. And this year we're seeing really, really high levels of interest in redesigns. So 24.5% planning redesigns, about 14% in process with the redesign. So if we put that together, we look at the organizations that are either planning a redesign or in the process of redesign. That's about 38.5% of the total. That's really high for that number. It's a little higher than we saw in our last survey, which we thought was high at that time as well. That kind of combined total was just under 35% at that point. So about 3.5% growth or so from last year to this year in terms of that interest in redesign. Here's the interesting thing though. If we look at the red bar there, that's the organizations that have completed a redesign in the last 12 months. So we had about almost 35% of organizations indicating that they were planning a redesign or doing a redesign in our last survey. This time around, we see that only 17.2% were able to complete a redesign in the past year. And again, I think that's indicative of the financial crisis that we've been in over the last 2 years as an industry. A lot of pent-up demand. A lot of these organizations have been delaying this project throughout much of COVID. Maybe we're even hoping to get into a redesign getting into 2020. But even at this point, about half of the organizations intending to do a redesign were unable to actually get that project funded or get that project done. So we've got this continued growth in interest. It'll be interesting to see if, as the financials improve for the industry, if more organizations are able to actually get these projects funded, get the budget, and get these projects going here in 2024 and into 2025. Now, when we look at replatforming, changing the content management system, this is always a smaller group. And almost everyone who's doing a CMS change or pondering a CMS change is doing so while also doing a redesign at the same time. We actually had kind of a high number here coming into this. So our last survey, the number who completed a platform change increased this time, I should say. So we have 11.5% who've recently completed that change. And when you think about the fact that only 17.5% have done a redesign, that's a huge portion of the folks who have done a redesign who have also done a platform change, because there's very few people, again, doing platform changes who are not also doing a redesign. But as we look at our plans going forward, the numbers are a little bit smaller. So those planning a redesign or planning a platform change was 17.5% in our last survey. It's 11.5% today. The number who had a change in process, we had about 8% in our last survey who had a change in progress, a little less than 5% who are in that position today. So I think, again, reflecting on that financial condition, we have lots of organizations trying to get things done from a redesign perspective. And honestly, a lot of them, I think, in order to navigate their internal budget process in the current environment, are deciding not to maybe do that platform change that they might have been planning, and instead just try to get the redesign done because they think they can get that through the budget process, get that approved. So that leads us to what organizations are actually doing online. What are the things that are important to them? What are their current capabilities for these things? In our last survey, and this is looking at the importance side of that equation, appointment scheduling for current and new patients was the top of the list for importance. And both of those things ranked highly again, with a couple other things kind of mixing into that top level of ranking: provider directory, online bill payment, and virtual care. So those kind of consumer self-service capabilities clearly perceived to be the most important thing for the success of digital marketing here in the coming year. While there's a lot of alignment between our different segments here, we do have a couple of areas where we saw some differences that we wanted to highlight a little bit. Point you first to mobile apps. I told you we'd be getting back to that a couple times over the course of things. It's still languishing way down at the bottom of the importance list overall. But you see, we've got a group of leaders here that are investing in a different way from everyone else. So for the organizations that are investing here, they see this as a real opportunity for competitive differentiation. But so many organizations are not touching this. So many organizations are not investing here. They obviously don't see this as critically important for what they're going to be doing in the coming year. And so that it falls down the list in terms of those overall rankings. Let's look next at content, health content, right? So this has maybe dropped a couple of positions from where it was over the last couple of surveys, but still maybe in that top third from an overall importance perspective. Leaders find it important. Average finds it important. Interestingly enough, the Laggard group has a significantly lower importance level placed on health content. Now, some of that may be that they're just not able to invest in it in the same way. It may also just be a factor that some of the things where health content really has the ability to move the needle, or where you just need a lot of really quality health content being generated all the time, that they don't have some of those capabilities. Things like personalization or email marketing or marketing automation, some of those kinds of things. You just need a lot of content to feed those parts of the marketing ecosystem. And if you don't have those things, maybe the overall importance of health content becomes a little bit less in that context. CRM continuing over the years to sneak further and further up the list. We do see more organizations with a CRM, although we do certainly see more CRMs in place with leaders than we do for everyone else. And so we again see a higher importance being placed there, but we see a higher importance being placed by leaders on pretty much all of these items. Anecdotally, we also see that those leader groups, more and more of them are looking not just at CRM as marketing CRM, but when we talk about CRM, they're getting into enterprise CRM evaluations as well. And so the importance of those initiatives may help boost things for those leading groups as well. The last one where things are a little bit different is identity management and single sign-on. Again, this is seen as a nice to have for most of the organizations responding to the survey, but we do see a group of organizations, particularly those leader organizations, that are doing more with authenticated experiences in the web realm, above and beyond what they're doing maybe with the traditional patient portal experience. And so if you're going to go down that road, having single sign-on capabilities to make things seamless for your consumers going through, really, really important to make those kinds of solutions ultimately work. All right, let's talk a little bit about goals and barriers to accomplishing those goals. So as we look at what goals are most important for healthcare digital initiatives, we do have a couple of important changes from what we saw in our last survey. Consumer experience, consumer engagement, consumer awareness were at the top of the list in our last survey, still pretty high up, although maybe the order shifted just a little bit there. But we've got some new additions here which really kind of jumble things up or make us think a little bit about what's happening in our space. The first is ROI, and the second here is digital transformation. So ROI, I think, reflective of those financial challenges, and with tighter budgets, cuts, things like that, it makes sense that there would be a lot more pressure for every part of the organization to justify its investments, but particularly when you're in those non-clinical operations, the things that I think a lot of organizations are seeing as easier to cut from a budget perspective or trim back from a budget perspective, the ability to justify what you're doing from an ROI perspective, more important now than perhaps ever before. The digital transformation shift is maybe a little bit different story. This was one that we added in the last survey because we were just seeing this kind of language pop up in a lot of organizations that we talk to and that we work with. But last year, it showed up quite low down on the overall importance list for goals. And we sort of interpreted that to be, well, digital transformation for its own purposes, maybe not that important. The things that you can accomplish through digital transformation, like creating great consumer experiences, those are the things that organizations were focusing on and that were most important. This year, though, digital transformation jumps quite a ways up the list. And so it's a little unclear if that's because more organizations are engaging in digital transformation, if we're seeing more pressure from startups and big tech and other places outside our traditional set of competitors, where we really need to change things in order to be more competitive against some of those new entrants in our space. Or if it's just the idea that digital transformation for digital transformation's sake has become more important in a lot of organizations and the way that they're prioritizing things. And so I hope it's not the latter. I really think that any digital transformation initiative really needs to be focused on the things it's trying to accomplish, but we do run that risk as we see the perceived importance of this moving its way up the list more and more. At the bottom of the list, interestingly enough, is employee engagement, fundraising, and recruiting. And obviously the one that sort of stands out there, employee recruiting, with the staffing challenges that a lot of organizations have had over the last couple of years. It does seem like there's been more focus on employee recruiting, but it does seem like the goals for digital continue to be really focused on consumers and patients. Now, in addition to the goals, we then ask for each of those different categories, how well are you able to demonstrate digital marketing's impact on the progress of those goals? And so in our last industry survey, we had ability to demonstrate top items for things like consumer experience, consumer engagement, and patient satisfaction. This year, again, we've got those up there, but we've got patient acquisition and recruiting employees near the top of that list as well. And again, some of that is probably reflective of the priorities. Even if as a goal it's relatively low on the list, I think none of us can question how important employee recruiting and employee retention has been for all of our organizations over the last couple of years. But in addition to that, patient acquisition and employee recruiting are just more tangible goals. It's easier to measure, it's easier to demonstrate the impact that these things have had. And so compared to something like consumer experience, where definitions vary and it's a little bit harder to quantify in a consistent, repeatable, defensible way, it's really easy to demonstrate how the things you're doing impact patient acquisition and employee acquisition or employee recruiting. And so we're seeing those near the top of the list now as well. Now, those are the things we're trying to accomplish. What is getting in the way? And we've asked this question over the years. And in almost every case, the lack of tools has been high on the list in terms of barriers to success. The lack of expertise has been high on the list for barriers to success. And then this year, out of the blue, we had this thing jump to the top of the list. That's privacy and regulatory concerns. And this is really, we believe, indicative of that 2022 guidance on HIPAA tracking technology, and which is, I think, impacted our organizations in a lot of different ways. So certainly, because a lot of organizations have had to pull tools down or change tools, so the numbers may not match up, it's made it more difficult to justify or to defend the investments that are being made, to demonstrate the ROI of those investments, things of that nature. But in addition to that, there's been a huge amount of time and energy and resources put behind evaluating the tools that are in place, evaluating the tactics that are in place, in many cases decommissioning tools that we don't feel good about in the current environment, maybe bringing up new solutions that almost inevitably cost more for the organization in that process. So there's been a huge amount of effort there that hasn't really moved the digital marketing sophistication of our organizations forward in meaningful ways. It does protect patients better, and I think it's a good thing. We'll talk more about that when we get to the HIPAA guidance, but we can't ignore the fact that it has really diverted a lot of energy and effort from moving forward on core things that we're trying to accomplish. The other thing is, you look at this chart that just jumps out clear as anything, is the fact that laggards are experiencing these barriers at a level that's dramatically more significant than either the average group or the leader group. Now, having looked at this chart over years and years, I see this as huge progress, because what used to be everyone had barriers. And then for a while, leaders really had eliminated a lot of those barriers. But our average cohort and our laggard cohort were the ones that were way behind. Now the fact that it's only the laggards that are feeling this pain is huge progress for our industry. But if you're one of those organizations, this still represents big challenges to try and accomplish the things that you want to accomplish from a digital engagement perspective. All right, let's shift to talk a little bit about digital marketing channels. And we're looking here at the relative importance to these healthcare respondents of different digital marketing channels out there. Now, the top, not really any surprises here. The organization's website's number one, organic search, content marketing, paid search, Facebook, both organic Facebook and Facebook ads, all at the top of that list. Content marketing was actually, I think, number 2 behind the website. It had been a little bit higher. It snuck down just a little bit. But this represents the core of what most of us are spending most of our time, energy, and attention on when it comes to digital marketing out there. So no surprises there. We also have a set of social platforms that are still pretty much in the nice to have category, or the I don't really have time to think about this category, right? Snapchat, TikTok, hyper local social media, kind of the next doors of the world, Threads, and of course the continued decline of X or Twitter. Nextdoor is kind of an interesting one. It it has a really big group of folks saying it's in the nice to have category. Not a lot of people looking at it as a must have or competitive differentiator, which is why it ends up so far down the list. But there's actually quite a few organizations saying, well, this is kind of in that nice to have category, even if it's not something that they absolutely have to have. So a little different pattern just on that one. We did also ask this question of our agency vendor group. We don't have all the data in here. The interesting thing from that side of things was really that the agencies were much less likely to say anything was not important. So we have a lot more nice to have, kind of a higher level of importance put on just about everything in the list when you score it out. In particular, though, there was more value in things like Snapchat and TikTok and X. Now, I'm pulling a couple things out of that previous chart because one of the underlying reasons we added this in our last survey was because we wanted to be able to compare for the same channels how important is the organic version of a channel versus the paid version of a channel. And I know that the world's not as simple as that, and a lot of these platforms, your organic reach and your what it costs you to do ads, or sometimes these things are a little bit intertwined. But we just kind of wanted to get a sense of how much of a pay-to-play world is it? And the answer is, for our key platforms, it really is largely becoming more and more of a pay-to-play world, right? When we look at Facebook, when we look at Instagram, when we look at YouTube, when we look at the search engines, and Google in particular, we see that gap between organic and paid use of the platforms pretty much disappearing. In fact, on Facebook, you could argue that the importance level of ads is actually a little bit higher than the organic version of the platform. That's the first time we're seeing that play out quite the way that it does. We also see a bunch of platforms where that gap is still pretty large, right? LinkedIn, which struggled to find its way to a revenue model, and I think their tools for advertising are not as robust and sophisticated as some of the other platforms. Is still lower on that list in terms of a bigger gap between the importance of ads and the organic platform. And then some of the platforms where there's just a lot of uncertainty seems to lead first to pulling out of ads, even if you're still engaging with that platform organically. So TikTok is in that boat, and of course X is in that boat as well. As we see kind of the continued decline in X, ads is one of the areas where that has really continued to fall off. I think I saw something today that Elon's planning to start suing organizations for having stopped advertising on their platform. Seems like a great way to get advertisers back. If you're going to go down in a blaze of glory, go for it. It's fascinating to watch. All right, let's get into a couple of hot topics here. We're going to touch on HIPAA guidance. We're going to touch on AI. Starting with HIPAA guidance, and it is a fascinating time to be talking about HIPAA guidance. I think hopefully most of you are aware, in addition to all of the uncertainty and all the craziness that's been going on this topic for the last, 18, 19 months. 2 weeks ago, right at the end of June, we got a summary judgment in the lawsuit that the American Hospital Association had against Health and Human Services and OCR. So I will weave a little bit of what we're seeing there in along with the data that we've got here. But let's start by just getting a little bit of a temperature of where things are at. I think most of you have heard me speak on this topic. It seems like it was all we had to speak about last year. But such a wide range of variability in terms of the interpretations of the guidance from December 22. and the way that organizations were reacting to it, and what they were doing or not doing to adapt to that regulation. And I think this chart, which is looking at how organizations are using web analytics given the guidance, is an ideal illustration of just how all over the map we are right now. 1 in 6 health systems, and again, we're doing this like March timeframe kind of for data collection, so a good 14 months after the guidance came out. 1 in 6 health systems had no analytics on their site. They pulled it down more than a year later, still had no analytics on their digital properties. The other end of the spectrum, we have an equally large group that is continuing to run Google Analytics as is with no modification, right? Both ends of the spectrum, and I would say, for the record, neither one strategies that I would endorse, but that represents a third of all health systems were either had made no change or pulled things off and were just sitting back until they could have more clarity on how to move forward. Much more common, though, was to take some other approach or strategy to get to analytics in a way that was more conformant with the guidance. For leaders, they've got those larger budgets, and nearly all have opted to invest in solutions for secure analytics, whether that's bringing it in-house or going with some sort of outside platform that will sign a BAA, both of which can be a substantial investment to make. Our average group, our Laggard group, more often opting for the less expensive approach of implementing a privacy filtering solution as a way to make GA4 compliant. And we have one of those solutions. There's a couple other solutions out in the marketplace. You can go search our website if you're not sure what that is or how it works. There's some information on our website that can walk you through kind of what that strategy actually means, because we did get a sense that not everyone's familiar with what that means out there. We also looked at how organizations were adapting their use of digital marketing. And what we found here, first off, is that almost no organizations stopped advertising as a result of this. It was a small group, 4% of the overall picture. They were all coming out of that Laggard group. And our assumption is that this was not a particularly large or particularly important part of the overall digital engagement strategy that they had in place. So not a lot of pain in just shutting it off rather than dealing with all this kind of stuff. Again, a very small group out there. We also have a little bit bigger group, although still a small group, about 8% of the total picture, that are continuing to use digital advertising with tracking pixels, no changes, right? So again, we're seeing that full spectrum, but to a smaller degree than what we see with analytics. Overwhelmingly, the way that organizations are approaching this is they're continuing to do advertising, but they're not using tracking pixels, and they're just giving up the automated optimization and some of the other sort of robust capabilities that some of these platforms are bringing to bear that have made these things more effective tools over time. We do have a group, though, that again is using a privacy filtering solution to do this in a way that delivers less information up, keeps organizations compliant, but continues to be able to use some of those capabilities. That is most common with our leader groups, but we do see folks in all 3 of our cohorts engaging with some of those solutions to a degree as well. All right, so that brings us to the lawsuits. The American Hospital Association, along with the Texas Hospital Association, a couple of Texas-based health systems, sued Health and Human Services and OCR last year, essentially saying that the guidance represented a big overstepping of their authority. This was done in federal court down in Texas, and we got a summary judgment. Honestly, I thought this was a case that was likely to drag on for years, so it's nice that we've gotten relatively quick response to this. And in the end, the judge looked at this and said, yes, there's a role for judicial oversight in this, and yes, elements of this are clearly unlawful. And the elements that he really pointed at here were all in the area that I think most of us have focused our time and energy on, which is in these unauthenticated web experiences. And there were a couple things there that were big shifts that the guidance introduced, right? One is that IP address URL combination being protected health information, right? If you have an IP address and you know someone's looking at a page related to a symptom or a condition or searching for doctors, whatever it may be, the guidance said, hey, you have to assume that you can identify the person. You have to assume that that person is looking at this information based on the fact that they've either received care for this in the past or will receive care for this in the future. And the judge came in and say, hey, substantively, I have issues with this. You can't just assume that because someone's coming and looking at this page, that they're looking at it for their own care. And if you don't know that it's for their own care, you don't have to assume that it's for their own care. And so basically said that IP address URL combination on its own, that is not sufficient to be individually identifiable health information. And so you don't have to worry about that in the same way unless you have something else that makes it IHI. The second piece is procedurally, the judge said, you know what, like you clearly have changed the rules, you've imposed new obligations on the people you're regulating, and this is not the way that we do that. You failed to follow the right process, and so procedurally, this also kind of knocks things out of there because you need to follow an appropriate process if you're going to impose new rules on folks. So if you want more, I encourage you to go out and work through the actual guidance. And we're starting to see more and more legal commentaries coming out from law firms explaining it as well. But I think right now, a lot of organizations are just looking at it and saying, what do we do? In those days immediately following the summary judgment going public, I saw a bunch of organizations essentially sharing that AHA press release with some kind of message on social media that thank goodness this is all done. And I think that's the wrong approach. I think we need to be a little bit more careful about how we think about moving forward. My guidance to you is that you should not abandon the new tools, the new tactics, the new governance models that your organization has been putting in place in order to better protect consumer privacy, right? And even though this reduces regulatory risk, there's a bunch of reasons why it's a good idea to continue down this path. Let's look at those here real quick. At the top of that list, I think, has to be that this is the right thing to do, right? I think we've all felt for a long time that this is the right thing to do in terms of protecting consumer privacy. Consumer privacy is a priority, and we've been a little bit cavalier about the way that we've approached some of these things. We haven't been really careful about making sure that we're checking and documenting what data is getting passed to different third parties. We haven't really thought through the scenarios and the ways that this stuff may or may not be appropriate or something that we're fully comfortable with, even if it's technically legal. So I think this is an area where we can do better. We have been doing better, and I think it's a pathway that most organizations should intend to continue to move down. In addition to that, it's likely that this is the last that we're going to hear about these issues from OCR and from HHS. Right? They have the option to appeal the judgment. I think they've got a 60-day window from when the summary judgment was printed. Yes, this judgment rolls back much of the guidance, but it does not keep them from kind of going down this issue again in the future. So they could appeal, they could go through and follow a formal process. And my position all along has been, if you're going to do this, there are right ways to do this, and there are wrong ways to do this, and this has been a wrong way to do this. But going down the pathway of being clearly putting out a detailed explanation of what the expectations are, what the new rules are, what the new obligations are, having an open comment period so we can have some of that back and forth and get clarity on what's meant by these things and what does or doesn't work in order to deal with these obligations, have an implementation timeline, like the things you would normally see when a regulatory body is adding new rules. I think those things may come into play as part of a new process that they would go down. And it wouldn't surprise me at all if we see that be the ultimate outcome of this. In addition to that, just because some categories of stuff have been carved out here and the judges said these are not a breach, he does leave it open that there are some places where you could have breaches, right? This doesn't impact authenticated web experiences. So if you've still got tracking going on inside your patient portal, for instance, that's problematic. He also specifically calls out scenarios where you might introduce other data into the mix that moves it from not being IHI to being IIHI. So, this would be, he sort of says it's unlikely, but if you're asking someone why you're on the page today, then you may in fact be completing the puzzle for I'm looking for data for myself and seeking care. Here's my IP address. Here's things I'm looking at. Suddenly it could become IIHI or PHI through some additional information. He notes that this is pretty unlikely, but certainly if you're doing surveys on your site to gather data, if you've got personalization when you ask someone, why are you here today, in order to do personalization, I think there's some scenarios that we see in the real world from time to time that absolutely could trigger this becoming IIHI instead of being non-protected information. And then, of course, regulatory compliance is only one of the flavors of risk that we've been dealing with this whole fiasco. We've got these class action lawsuits out there. Many of them were at least getting started there before this guidance ever came out. It's unclear at this point how much this summary judgment is going to impact the progress of those cases. Now, I think we're still hopeful that we'll get a couple of these cases through and there won't be big judgments that come out of it, and that will kind of let the steam out of that whole bubble. But for right now, it's really unclear what the impact of this is going to be on regulatory compliance. As a secondary element on this, and this was just brought up to me here recently, a lot of our cyber insurance companies have come through and made us promise not to do these things. So even if the compliance risk has disappeared, you may be making promises to your insurance companies that you're not going to use these things without additional protections out there. And so make sure you understand those sorts of things before you start to roll back some of the new steps that you've taken to further protect consumers in this process as well. Now that does lead us to the question of lawsuits. And again, the lawsuits started really coming out of the reporting that preceded the guidance in earlier 2022, not directly connected in many cases to the guidance, although I think that poured gasoline on that fire. But we did ask, are you getting sued as related to some of this marketing tracking issues? And 8% of organizations in the survey said, yes, we are. Another 22% said, I'd rather not talk about it. So some of them may be getting sued. Some of them may have gotten early indications that that lawsuit is coming. But even if it's just 8%, that's a huge portion of the overall healthcare industry that's dealing with litigation around this issue. The other thing that's interesting here is this isn't all grouped in one of these categories, right? It's not like the leaders are getting sued, but no one else is. This is pretty evenly distributed. So it doesn't matter if you're the highest profile organization or the most sophisticated digital operation out there, your likelihood of getting sued seems pretty consistent across the board here. All right, I know I'm running short on time. Very quickly, generative AI. No topic has garnered more interest here, more hype. What we're seeing here is that only a small number of organizations, about 7%, have gotten to the point where they're starting to even formally incorporate these technologies into their processes and workflows for marketing and digital engagement. But fully 2/3 are at least experimenting with these things, and that's where most of that interest is. We ask how they're using generative AI. Lots of interest in content creation, although with a heavy dose of skepticism around efficacy, accuracy, and those sorts of things. A lot of interest in generative AI to help boost SEO, and then a lot around the creation and manipulation of images, and some particular call-outs to some of the new capabilities that Photoshop has brought into the mix there. When we ask about how organizations are measuring the success of their generative AI efforts, the answer really is that most aren't, right? Everyone's in the experimentation phase, almost everyone's in the experimentation phase. But to the extent that folks are thinking about this, if they're in that content creation, they're looking at the metrics for how effective is the content out there, doing A/B tests between AI optimized content and that which is not, looking at engagement metrics when we're putting content out there, things of that nature to see if it's working, if it's effective. The other side of this coin is efficiency. How do we boost the output of our people and stretch them to get more done with the budgets that we have available? And then finally, when we ask about what is preventing organizations from using generative AI more, certainly the lack of skills and training is a big issue. In many cases, organizations have locked down their ability to access these tools from their work environments. There is some very real concerns about legality and copyright, HIPAA and some of those kinds of things come into play, but even just copyright for content generation is a big concern, and I think rightly so. A lot of concerns about the quality of what's being output here. Is it not in our voice? Is it just badly written? Some of those kinds of things, some of which will improve as the tools improve, some of which will improve as the people prompting the tools improve as well. And then finally, we had a number of people who sort of just expressed kind of an ethical concern. It feels like I'm cheating if I have the machine do it for me. And I think that's something that we're going to have to work through as these tools get ready for prime time in a way that perhaps they're not quite there today. All right. So final thoughts as we wrap this up. We are definitely in this post-COVID recovery, but that recovery is mixed. And so while we're seeing significant growth and investment in digital, that gap between our leaders and everyone else is growing. The organizations at the lead, it's very clear that they see this as one of the new big competitive landscapes for healthcare, and the way that they're going to compete against some of these new competitors, some of the ways they're going to compete with other traditional competitors. And the organizations that are doing it well see this as a way to dominate in their space. So that race for digital dominance is on, and I think the organizations that are not able to keep up, I think, are going to really struggle in terms of being as relevant in the future as they are today. So I know we're past time. I can stick around for a few minutes and answer a couple of questions. And so, Tom, do you want to take the floor?
Yes, thank you, Ben. We do have a question. So the question is, with the impending removal of third-party cookies and the increasing shift toward digital marketing, how do you anticipate this will impact our industry? And the second part of that is, what strategies or adjustments would you recommend for marketers to stay effective in this evolving landscape?
So I think that the third-party cookie mix is complicated. It's a big subject just in terms of how do we continue to connect the dots for some of these services over time. It does seem like first-party cookies are pretty well established, and so I know that there's some tactics that are inevitably going to kind of come in and take some elements of this stuff over. At this point, I'm not too concerned. It's going to change the landscape, but it's going to change it largely for everyone at the same time. And so I think it's just gonna move the needle for everyone, and things are going to balance out a little bit. I think there's a lot of unknowns in that space, and honestly, this is one of those areas where I would pull in someone who's a deeper expert on this in order to be able to speak to that particular one. But I'm not too concerned about it rocking the boat, because it's not something that's just going to impact us and not impact other folks. It's going to kind of hit all of us together.
Okay, waiting to see if any other questions pop up. Yep, so here's another one, Ben. You mentioned leaders feel they will excel in digital strategy, personalization, and innovation. What are they doing differently in those areas that a non-leader organization should be prioritizing?
Sure. Well, I mean, the first thing is they're investing there, right? So, the clearest line through this is in that digital strategy area. We saw organizations investing in bringing digital strategy talent into their teams in our last survey, and this year they feel like they're doing much better in the digital strategy realm in this area. So, I do think that for the organizations that are at the leading edge, the kinds of problems that they're tackling today, it's not entirely clear what the next set of solutions look like or the way that they're going to navigate those things, right? The demands of things like digital transformation are very different than I've got a laundry list of things that I want to do with my website, and I know it's going to be years and years and years before I get all of these things in place in the way that I want to. We're at a point today where a lot of those core capabilities are in place, and yes, we can continue to optimize them. We can continue to make them better. But when we're looking at how to fundamentally change the experience out there, or integrate between what we're doing from a marketing and engagement perspective and a clinical and caregiving perspective, I think those are different kinds of problems where you just need to have people in the room in your organization who are working through finding the right solution for your organization there. I think innovation falls into that camp to a large degree as well, although I think everyone's investing in innovation to some degree out there. And then, again, for some of the other things, a lot of those advanced technologies is really a question of, do you have the organizational commitment in terms of staff and priority? Do you have the organization commitment in terms of being able to put the dollars on the table? And, for something like CRM or personalization or some of these other technologies, right? You can get there, but it just means that your organization has to be committed to getting there and to using the tools, right? Buying the tool and having it sit on the shelf, not having staff behind it or partners who are throwing energy and attention into it doesn't tend to get those things moving very far very quickly.
All right, so in the interest of time, I know we're running a little bit over. I thank for everybody. Thank you for everybody for staying on. Ben, I want to thank you for it was a great insight into what is trending in healthcare digital marketing. And we all want to thank you all for joining us today. As you can see, if you'd like a free copy of the 2024 Digital Marketing Trend Survey ebook, you can scan the QR code on the left for a quick download. But if you prefer us to send you an emailed copy, stick around for the quick survey at the end, where you'll have the option to have us send you a digital copy directly to your inbox. On the right as well, as a bonus on today's webinar, you can also access our Optimizely DXP ebook that was released in February of this year. So if your CMS isn't growing with your organization, you may want to consider Optimizely's robust digital experience platform. And as well, keep an eye on your inboxes and our social media channels for our next webinar announcement. Again, thank you all for attending the webinar.
Thanks, everyone.